Brooklyn Independent Television.
Coming up on HealthBeat Brooklyn.
There are 2.5 million New Yorkers that don't have adequate access to primary care.
With the help of two healthcare experts, host Monica Sweeney digs deep into what President Obama's chief legislative achievement means right here at home.
How will the Affordable Care Act actually impact Brooklyn?
The elimination of pre-existing condition exclusions and the expansion of coverage for people who are actually sick are really groundbreaking.
There are many provisions in the Affordable Care Act that will help with preventative care. There'll be no co-payment at all for colonoscopies, mammograms, flu shots.
Exploring the very near future of healthcare. Right now on HealthBeat Brooklyn.
Welcome to HealthBeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. We are a little more than 2 months past the Supreme Court's decision to uphold President Obama's Affordable Care Act, or at least most of it. We want to take an in-depth look at what the new rules, regulations, and many pilot programs may mean for Brooklyn and New York City. How many more people will now have health insurance here? What impact will all those newly insured New Yorkers have on our hospitals, our clinics, our doctors? How much will we see our healthcare costs go up? Or will they? No one, of course, can give us definitive answers to these questions. But here to at least give us their expert opinions are the leaders of two organizations which will be deeply involved as the healthcare landscape changes over the next few years. Elizabeth Swain is the president and CEO of the Community Healthcare Association of New York State, which has represented hundreds of local community health centers since 1971. And Dr. Sam Unterreich is the president-elect of the Medical Society of the State of New York, formed over a century ago, and representing some 30,000 physicians, medical residents, and medical students. Thank you both for being here. So, can you start, Elizabeth, by telling me how will the Affordable Care Act actually impact Brooklyn and the larger city?
Yes, the Affordable Care Act is really the first health reform law the United States has ever had, and it will actually increase the number of people who are covered by insurance programs, and it will change the model of care that those people receive through their insurance coverage. So it's really important to think of it as two different things. In Brooklyn, what this means is that people who have not previously had access to individual or small business coverage because they've been priced out of those markets through the insurance industry practices will have increased access to those insurance programs. There's also going to be an expansion of the Medicaid program to people.
How much will that affect us, expansion of Medicaid?
The state of New York will see only 90,000 new Medicaid beneficiaries across the entire state. It's the first time that the United States has established a Medicaid program that's based on income, not on categorical coverage. So everybody up to a certain income level will be covered.
Everybody?
Everybody who is a legally residing citizen or immigrant in the United States will be covered up to a certain income level. And this is really a sort of a groundbreaking approach because we've never done income-based eligibility in the Medicaid program before. So many of Brooklyn's lowest income residents who've been priced out of the Medicaid market, if you will be covered by the Medicaid expansion.
Well, they were priced out of Medicaid, but of course priced out of private insurers as well.
Of course. If you're over 400% of poverty, then you're going to be eligible for other products in the market, small business and individual market products that are probably more complicated to describe than we have time for.
Actually, 400% of the market is complicated to describe too.